my name is Ignatia Micharina. I'm a nursing student from the Poltekkes Kemenkes Jakarta University 3. In these videos, we are talking about how to write a document, your admission history and physical. So let's check this out. Okay, you need two elements of how to write admitting patient. There are clarity and accuracy. The clarity will need accuracy. Then the clarity will have impacts on how you set up your note to write it, or frankly, your note to print it, to make sure it's actually readable, too. So there is clear heading, all that kind of stuff, and then the accuracy is making sure that you're documenting things properly. So these are the bits kind of two key principles that shall flowing through all of documentation of any type, but particularly for admission for physicals and major history. Okay, part 1, we are going to talk about history. How do you actually write to document it? So whether it's an electronic record or paper record, the principles are actually still the same. You need to be clear and you still need to be accurate. First of all, you don't get the patient ID upfront. Now the ID is usually their names already standing, so you are going to have already checked. Make sure you are in the right electronic record, or you have got the patient stamp or a name or the page on the paper. But on the ID itself, usually in the ID it sort of just gives the overall pictures. That's great. Now you might also in the ID include anything it has a massive impact on how this patient will be cared for. So at first glance the might seem, but let's say if the person severe adult developmental disability, then you will probably have written that in up here with developmental disability, and you will have writing is as part of full sentence, because that will change thing that will change. I mean, if somebody got a profound developmental disability and yet they are showing up with abdominal pain, that will be somebody who really reports pain. We've had different sorts of infections or whatever, so this could be even more than what you think. Or if it says somebody who, let's say, a different kind of patient who is homeless, somebody that dramatically care change or their care, and what's going to happen to them, and what the best way to do things into set things up so they are going to have the best possible outcomes for their health. And if somebody had active metastatic cancer, then yes, you would include that there too. So if you got 29 years old lady with non-metastatic cervical cancer, with right lower quadrant pain time 10 hours, that is a dramatic change to what would normally seems to be a fairly straightforward series. But one might seems to be a first client to be a fairly straightforward patient, so include in your ID kind of identification. Okay, next, goals of care should appear and history of presenting illness. Then we move on down to the other section, the story about presenting illness. Then you got to steal the picture for the patient, full background health. So past medical history and describe what it is. So last surgical history, so you can lump sometimes surgeries like I did earlier into past medical history, or having to this out different people like different things is probably better to test it out separately. What way you just sort of as clear, so maybe she had no previous surgery created. And then math, this where you can really hustle and do some good work So it's everything is per it's prescriptions. So any prescriptions, and then you should hand down what the dosage are if they have the pills. Then that amazing cook at the pills and confirm. Also includes like any herbs, or any natural therapies. Are they getting ADTA or whatever? If you want the detail, you should always document allergies. Direction, make sure always document to direction, because you never know when your record might be the best record available and people are to figure out do we give a risk or not. And then you also want to document cigarettes use, you want to document alcohol use or drug use. And finally, this is actually a really critical piece of things as well of patient social context. Sometimes people call the social context is social history. Now the social history context critical for two reasons. One is that helps you understand the patient, because sometimes this in higher context change how you understand what's going on with help with them. And number two, it can help change how you manage them. So for instance, if you find out in their job. So this level of functions is key now. So general with the history, you want to lay things and clarity on all the features. You want to get a level of detail, but try to present it in a clear and accurate way. Make sure your subheadings are incredibly obvious, the different heading and so on, and then you make clear if there are like different elements or whatever that you are exploring, or a lot of detail instead having large run on paragraphs. It's usually better have it point from, because it will help you and other people find the same information. Okay, next we are going to talking about how you document physical exam and also how you document the assessment and plan. So first all, the physical also in the on exam, and you can write on exam or vitals are gonna be important. They are called that because they are the vital. So your vital, you're gonna what a flex, so heart rate, BP, that is important too. Okay, next, general. So it's good to give a general overview what you are actually seeing, and is any is bad, make it a professional decision. You never use no acute distress or no apparent distress or an AD. And from then you just go down through the system. You can do it different ways. I have to say most colleagues say it easy to just go from the head down, so the head and exam, so the respiration exam, cardiovascular exam, and so on all the way down, like CNS exam is sort of separate from a head and actually include cranial nerves. Also other things here as well, and try to keep everything lined up nicely. You get some nice heading to make it clear, and you put down all your physical findings in the appropriate section. Then at the very bottom underneath your physical exam, you're gonna have any findings, any investigation like some blood work or x-ray, and then you're gonna have your assessment. So it might be like what the things going on and your diagnosis. And then your plan, here is not your detail orders, This is just like you're gonna admit, you're gonna treat, O2 until no longer depend. I think that enough. So again, you must be clear and to be accurate when there's any sort of question about what's going on with these patients, physical exam or whatever, just look at them more if there's any question on investigations and there's things that you're not clear. You can actually even add in any future plans. As you still need to clarify, you are seeking some degree of certainty about these things so that you and other and provide the care for the patient. So if there is any future plans, whatever, so you can put some painting test, and so in general, so clear, be accurate, lay out your note in a way so other people can easily find information about this patient and put things in a nice clear format, and then you are be star of both patient care and also demonstrating your clinical ability, because you are able to record and document in such a good patient watching. Okay, I think that's enough. Thank you for watching and see you.